6 deaths and more than 30 near misses because of clogged ER waiting rooms. Alberta doctors going public with that claim, detailing the cases in a letter to the government. Dr. Paul Parks penned it. He claims hospital hallways and waiting rooms have become, quote, death zones.
You know, it's really morally distressing. It's very upsetting. I almost threw up after the second page. I couldn't read past the second page.
Dr. Ross Sherman says parts of the system are at 110% capacity, and it's not just the flu causing it, because pressure has been building for years.
We desperately need more staff in the system for the amount of illness that we have out there. And the current government is in complete denial, and people should be really concerned about their safety.
The Alberta NDP now joining Dr. Sherman in calling for urgent action. Leader Naheed Nenshi says the government needs to declare an ER crisis, recall MLAs for an emergency session in the legislature, and return authority to a single health agency.
Just like we do when there's a natural disaster, we did during the COVID pandemic, put all the ideas on the table, cut through the bureaucracy and the decision making, figure out how much money it's going to take to implement these ideas, and just go.
Aside from cutting waste, Nenshi wouldn't say how that bill should be paid, but he blamed the government for ignoring a growing crisis.
One of the first acts the UCP government did is they canceled the building of the South Edmonton Hospital. If that hospital was not canceled, it would be opening right now.
Alberta ministers on Tuesday announced plans to open 97 new beds at the Peter Lougheed Centre in Calgary next month. While acknowledging pressures and the letter from doctors, the government insists the system is still safe.
Our emergency departments see about 2 million visits per year, and in a very small percentage of those cases, 0.07% roughly, people do lose their lives. And that what we try to do is we try to learn from those as a system.
The infrastructure minister says there are 8 hospital construction projects underway, but couldn't tell City News how many bed spaces those will add to the system.
Between planning and design, we have over 1,000 new bed spaces being contemplated currently. I don't have the complete list of new bed spaces on these construction ones. I will look to my team to get that information.
The NDP claims the number of new bed spaces under construction across Alberta is 0. Nenshi says the UCP constantly talks about more beds being planned and designed, but alleges they're not spending the money needed to actually build enough hospital spaces. From Edmonton, Sean Amato, City News.